This is our injector Susan, and the question for Susan is what's changed since you've started doing injectables?
Okay, well I started doing cosmetic injectables about 12 years ago, and what's changed from when I first started injecting was we used to actually inject what the symptom was. So patients will come and saying, I've got lines through here that are my concern, just can you put filler in there? And now what we do is we actually look as to what the causes of these lines. For example, for the nose to mouth lines, these ones here, often it's a volume loss, so we have to put volume back in the cheeks, which lifts the face and therefore improves the nose to mouth lines. Volume changes heaviness to the lower face. Sometimes it can be volume changes through nearer ear, so we actually now put filler around this area here, which ties and pulls back the lower face. Instead of putting a lot of filler in the mid face, we think more laterally and put volume laterally to pull the face back.
The face is a three-dimensional structure.
That's exactly right. Yeah. So we look at three-dimensionally. Even though you may come in and you're looking at two-dimensional when you look in the mirror. We look at all different angles and trying to work out what the causes of your concern and have different ideas of how we can treat your concerns.
Thanks, Susan.